Welcome back, children. We are going to continue with the lesson Human Health and Disease. There are some common human diseases like malaria, amoebiasis, ascariasis, elephantiasis, also called as filariasis, typhoid, pneumonia, common cold, ringworm, dengue, and cancer. So we are going to discuss about today in this lecture, in this video, typhoid, pneumonia, common cold, ringworm, dengue, and cancer. From these diseases, some are common diseases while some are very dangerous and severe diseases. Malaria, amoebiasis, ascariasis and filariasis we are going to discuss in the classroom. Today we are going to study about these mentioned disorders or diseases, and the very first one is typhoid. Typhoid, it is an acute infection of intestine. The causative agent is Salmonella typhi. It is very important. Causative agent is Salmonella typhi. It is a bacteria. It is a gram-negative bacteria found in intestine of infected person. Symptoms of typhoid: prolonged high fever ranging up to 104 degree Fahrenheit. Then nausea, that is feeling of vomiting, fatigue, that is extreme tiredness, headache, abdominal pain, constipation or diarrhea, that is bowel movement get disturbed, rashes on the skin, white coat on tongue, cough, anorexia, indigestion, breathlessness, irregular heartbeats. These are some you can say symptoms of typhoid. If typhoid is not treated, it may cause hemorrhage also. Here in this picture you can see some signs and symptoms of typhoid. Just go through the pictures. Modes of transmission. Typhoid is transmitted from contaminated food and contaminated water. It is a foodborne and waterborne disease. Insects like cockroaches and housefly, they may transmit or transfer this disease or bacteria from food. Then poor hygiene, then poor sanitation also. These are some modes of transmission. So symptoms and modes of transmission, causative agent, these some topics are very important. Diagnosis and treatment. Vidal test is used for diagnosis of typhoid. Just remember Vidal test. It is a common test mostly used for the diagnosis of typhoid. Treatment of typhoid involves surgical removal of gallbladder in severe cases. Antibiotics like chloromycetin is helpful in treatment. So antibiotic is given, that is chloromycetin, for the treatment of typhoid. There are some oral and injectable vaccines are available to prevent typhoid, like TY21A and typhoid polysaccharide vaccine. So these two vaccines are available, which are oral as well as injectable. You can see here in this picture about oral TY21A, that is a oral vaccine, and below there is a injectable, that is typhoid polysaccharide vaccine. Just remember the names of the vaccines for prevention and control. The next disease is pneumonia. Pneumonia is an inflammatory condition of lungs or alveoli of lungs. It is caused by various pathogens, disease causing microorganisms, which may be viruses like influenza virus, adenovirus, parainfluenza, and respiratory syncytial virus RSV, or bacteria like Streptococcus pneumoniae. Streptococcus pneumoniae is commonly called or commonly found microorganism or bacteria which causes pneumonia, or fungal pathogens also, that is pneumocystis. Pneumocystis jirovecii. These are some commonly found microorganisms which may cause pneumonia. So viruses, influenza virus, adenovirus, RSV, that is respiratory syncytial virus. Then bacteria, Streptococcus pneumoniae, and then fungus is Pneumocystis jirovecii. So here are the pictures of virus, bacteria, and fungus. Here are some signs and symptoms of pneumonia: cough, high fever, breathlessness or shortness of breath. It is also called a dyspnea. Person cannot breathe properly in dyspnea. Then chest pain during breath or during breathing or coughing, loss of appetite, extreme tiredness or fatigue, headache, vomiting, joint pain, and muscle pain. Mode of transmission: pneumonia spreads via droplets released by infected person. When the person sneezes or cough, that person may spread these microorganisms or pathogens in the air. So that person may contaminate the air, and healthy person can also transmit the same disease. Diagnosis and treatment: course of treatment depends upon pathogen leading to the disease. For bacterial pneumonia, antibiotics like benzyl penicillin, ampicillin, and chloramphenicol, that is also one type of antibiotic which is very effective in the treatment of pneumonia. Prevention and control: vaccination is very important in preventing in adults and children. So pneumococcal vaccine is given to prevent pneumonia. Common cold: the next disorder or disease is common cold. It is a viral infectious disease of upper respiratory region. It is also known as nasopharyngitis, acute viral rhinopharyngitis, acute coryza, or a cold. It is caused by a group of viruses known as rhinoviruses and coronaviruses. You can see the pictures of rhinoviruses and coronaviruses. Nowadays coronavirus has become very famous. So this is a one chart which shows common coronaviruses. You just go through the chart. SARS-CoV-2, SARS-CoV coronavirus, MERS coronavirus, then HCoV, OC43. These are some common names or some names, human coronavirus names, and they are causing some illnesses like COVID-19, the first one, SARS-CoV-2, then severe acute respiratory syndrome, then middle is respiratory syndrome, and usually mild respiratory illnesses. This topic will not come for the exam, just for your information. Symptoms of common cold: cough, sore throat, running nose, fever, then nasal congestion and sneezing, conjunctive eyes get sore, muscle rashes, fatigue, headache, shivering, loss of appetite. Prevention and control. Staying away from persons suffering from common cold. Washing hands with soap and water. Use of handkerchief to cover the nose and mouth during coughing and sneezing. Alcohol-based hand sanitizer can also be used. Okay, we were using sanitizer during COVID time. Okay, so same precautions we are supposed to continue, or we are supposed to follow during normal common cold also. The next disease we had already discussed in laboratory or in science lab in practical, that is ringworm. It is a fungal infection of skin and the causative agent is Microsporum endoi. Microsporum endoi, and the ringworm is also called as dermatophytosis. Derma means skin, so scaling of skin takes place and therefore it is called as dermatophytosis. Signs and symptoms. Red ring on skin, you can see in the nearby picture. Dry scaly lesions on body. Intense itching. Onychomycosis. Athlete foot. You can see the different pictures. Onychomycosis means you can see the picture of nail. Nails become very dry, yellowish. You can see the picture of athlete foot also. In between the toes, the itching takes place and the skin becomes very rough. Modes of transmission. Close contact with infected person. Sharing of clothes, comb of infected person. These are some modes of transmission. So ringworm, it spreads by sharing of clothes, comb of infected person. Close contact with infected person is another mode of infection. Diagnosis and treatment. Diagnosis is by physical examination and treatment uses drugs like fluconazole, itraconazole and nystatin. There are many other drugs also given like clotrimazole. Normally we say it as Candid B cream, then miconazole, ketoconazole, and then fluconazole and terbinafine. These are some ointments which are commonly used to treat ringworm. Prevention and control. You just have to avoid close contact with the infected person, not to share clothes and comb, other sport equipments of the infected person. Then washing clothes with hot water along with the Dettol or some fungicide or some, you can say, or we can use some disinfectant also like Savlon or Dettol in the water in which we are supposed to wash the clothes. The next disease is dengue. It is a fever, but it is very painful fever. Debilitating vector-borne disease caused by any one of 4 closely related dengue viruses. Dengue virus is transmitted through bite of female Aedes mosquito. The mosquito takes up the dengue virus when it sucks blood of a person suffering from dengue. It cannot spread directly from one person to another person. So it is not contagious, or you cannot say it is a transmittive disease, communicative disease. Causative agent is dengue virus 1, 2, 3, 4. Here are some symptoms of dengue. You just go through this picture. High fever, Then person's platelets become very low because these viruses of dengue, they directly attack on the liver. Person becomes very weak, he feels fatigue. If dengue is not treated properly on time, it is very harmful, it is fatal also. The next very dangerous disease is cancer. It is abnormal and uncontrolled division of cells leads to formation of tumor. When tumor is malignant, it is called cancer. There are you must have heard that there are two types of tumors: benign tumor, which is non-cancerous, but if the tumor is detected malignant, it is cancerous. So it is called cancer. So here are the types of tumors. Benign, it grows slowly and does not spread to other body parts. Malignant, it grows rapidly. Mortality rate is more than benign tumor. These cells spread from one organ to other via blood or lymph. The migratory process is called metastasis. You can see two pictures. The difference between benign growth and malignant tumor is shown. Benign tumor growth is very slow and non-dangerous at all, but malignant tumor, it spreads, or the cells of malignant tumor spreads very rapidly and they are highly dangerous. Here are some types of cancer. There are 5 main types of cancers. One is not mentioned here. Carcinoma. This cancer arises from epithelial tissue or lining the body organs is known as carcinoma. It includes breast cancer, lung cancer, cancer of stomach and skin cancer, etc. Then sarcoma. Cancer that arises from connective tissue is called sarcoma. It includes bone tumor, then cancer of cartilage, adipose tissue cancer, etc. Then lymphoma, cancer that arises from lymphatic tissue is called lymphoma. It occurs in the lymphatic nodes, spleen and tissues of immune system. The next is leukemia. Leukemia is commonly called as blood cancer. It is a type of blood cancer in which you know that WBCs are increased tremendously. Pathological increase in the WBCs, white blood corpuscle, it gives rise to leukemia. The blood contains millions of abnormal immature WBCs or leukocytes. Okay, and they are not able to fight against the infections, or they are incapable of fighting infections. So they don't play at all the role of defense mechanism. These are various types of leukemia such as monocytic leukemia, lymphoblastic leukemia, etc. And then the last one is adenocarcinoma. Adenocarcinoma cancer arises in thyroid, pituitary, adrenal and other glandular tissues. So hormone producing endocrine glands. So cancer of endocrine gland is called as adenocarcinoma. Causes of cancer. There are some factors which are responsible for the cancer or development of carcinogenic ingredients or factors. Chemicals like nicotine, caffeine, products of combustion of coal and oil, polycyclic hydrocarbons and steroids. Then there are radiations like X-rays, gamma rays, ultraviolet rays, etc. And therefore if you see near the MRI, X-ray lab, always there is a plate like pregnant women are not allowed in that room because these X-rays may harm fetus or infant which is there in the womb of mother. Then some viruses like oncogenic viruses, for example EBV, HPV, human papilloma virus. So there are some these viruses. They also, EBV means Epstein-Barr virus. So just remember the names of these oncogenic viruses. Then next is oncogenes. Several genes called cellular oncogenes or proto-oncogenes have been identified in normal cells, which when activated under certain condition lead to oncogenic transformation of cells. And the last one is addiction. Different types of addictions like smoking giving rise to lung cancer, chewing of tobacco giving rise to mouth cancer, lip cancer, etc. Then alcohol consumption may result in the cancer of esophagus, stomach, intestine and liver. And there are some drugs, they also give rise to cancer like marijuana, anaerobic steroid, etc. There is one table given on page number 236. You just go through that table, carcinogens along with the organs affected, table number 10.13, carcinogens and organs affected. You just go through the table. The very first carcinogen is soot. It is affecting skin and lungs. Then coal, tar, skin and lungs. Cigarette smoke, lungs. Then cadmium oxide, that is the one heavy metal, prostate gland. Then aflatoxin, liver. Then mustard gas, lungs. Nickel and chromium, lungs. Asbestos, lungs. Then DES, vaginal cancer. And then VC, liver cancer. So treatment of cancer. There are various steps, local and systemic. Chemotherapy. Chemotherapy includes certain anti-cancer drugs. The anti-cancer drugs check cell division by inhibiting DNA synthesis or are more toxic to cancerous cell than to normal cells. Then radiotherapy. It is used in addition to chemotherapy. Means along with the chemotherapy, radiotherapy can be used. In radiotherapy, the basic principle is to bombard the cancerous tissues or cells with the rays from radioactive materials. Then surgery. In surgery, the entire cancerous tissue or that lump or tumor is removed surgically. It has limited utility. In certain cases such as breast cancer or uterine tumor, the surgery is most effective. Entire breast can be removed or uterus can be extracted. Then immunotherapy. Tumor cells have been shown to avoid detection and destruction by immune system. Therefore, the patients are given substances called biological response modifier such as alpha interferon. This is a one type of protein or amino acid which activates their immune system. And the last one is supportive therapy. Supportive therapy is used to treat symptoms of cancer and side effects of cancer treatment. So you just go through the topic from page number 236. Treatment of cancer, very very important topic. So you just go through, it may come for 2 marks. So students, in next lecture we are going to study about the remaining topics like AIDS, then adolescence, then addiction, then drug abuse, and whatever topics are left like malaria is also left, amoebiasis, then ascariasis and elephantiasis. So in next video we are going to study the remaining topics. Please learn this part properly This lesson is also equally important, very simple lesson, but then too you can get 5 marks easily from this lesson. Have a nice day.